Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
Today in Neighborhood Health Watch, the topic is organ donation and transplantation. Organ donation is when you allow your organs or tissues to be removed and given to someone else. Most donated organs and tissues are from people who have died, but a living person can also donate organs. Blood, stem cells, and platelets can also be donated. Helen Spicer is a registered nurse with Henrico Doctors Hospital. She's also manager of the Virginia Transplant Center, and she's here to talk more about the misconceptions and also how a person can donate and why. But let's start. Thanks so much for coming, Helen.
You're welcome.
Start off talking about the status of organ donations in the country. I read just recently where the number of people needing organs is rising faster than the available donors.
Well, you're exactly right. As of today, we've got over 120,000 people waiting in the United States, and in Virginia alone there are 3,000. Majority, 80% of that group is waiting for kidney transplants.
Why is there still a need for a campaign to get people to donate their organs when the benefits are just so real and just wonderful? People who have had lung transplants can put down those oxygen
Absolutely.
tanks and live a normal life. Why is it so hard to get people to donate?
It's a good question. I think that the struggle we have in this country is sometimes I don't think we want to make some decisions that we need to in advance. But anyone can donate regardless of age, race, or medical history. In Virginia, we also have a donor registry, which you can sign on through DMV, and that will have you registered. That is actually passed by the Virginia legislature, that it will be your wishes for that. And so that helps for people to understand what your wishes were at the time of your death.
Very important. And dispel some of the myths why people choose not to donate. What, are they afraid of being disfigured if they...
Yes, some people are afraid that they can't have an open casket. That's not true. They are worried that perhaps I'm not really dead. It's not true. There are many safeguards that go into this issue as they come through.
And there's no difference in treatment or
Absolutely
care?
not. I would say that when you're sick or injured and admitted to the hospital, your #1 priority for your entire medical team is to save your life.
And talk about expectations. If you want to be a donor, what can you expect to happen? And if you are a recipient, how do you get on that list even to begin with?
Well, as a donor, if you're a living donor, you can register. You can call a transplant center and say, I'm interested. And then you would go through a thorough medical exam and psychological exam, and then be matched up with someone who needs a kidney and go forward. If you're a deceased donor, your family would work with the LifeNet team in our area who would take you through the processes, and you would then be matched up. Your organs would be matched, and one donor can save 8 lives now.
All right.
For a recipient to get on the list, there's still medical testing, and unfortunately we have probably one person being added to the wait list every 4 minutes in this country, and 22 dying on that wait list.
Wow, that's alarming. Helen Spicer, thank you so much for joining us with First at
thank
4.
you
We
for-
appreciate it.